Okay, so I think I know most of you here, but in case some of you do not know me, I am Dr. Judy Salvatierra. I teach psychology courses for the social science department here at the Waltham campus. I teach mostly human growth development, human sexuality. I also teach introduction to psychology and introduction to social research. And in today's discussion, we're going to focus on careers in psychology. And a lot of you indicated already that you're psychology majors or that you have an interest in psychology or have been considering psychology. And it is a degree that I really feel that regardless of what you end up doing, it really prepares students for careers in various fields. It can prepare, it can help you if you're planning to go into mental health, but also if you're interested in education, counseling, research, and applied fields as well. It is a very broad field, and there are many career options in psychology, which I guess that's the good part, that you have so many options if you go into psychology. But at the same time, I guess the negative is that it can feel overwhelming. There's so much to choose from that you're not even sure what to do. So hopefully, we can address some of those issues today in this presentation. So the way that I have organized the presentation, there are three main areas that I want to discuss. I want to first start off by talking about the different types of degrees that you can earn in psychology and maybe some of the type of jobs that you can get with each different type of degree. Oh, more people are coming. Then we'll talk about how technology is impacting the field, both in terms of research and in terms of psychological treatments. And then, as you probably are aware, we're in Women's History Month. So we'll spend a section discussing opportunities for women in psychology. Because one thing about the psychology field is that in the past, initially it was considered, it was a male-dominated field. It was considered really a male field, but in recent years, that has been reversed. It has become a female-oriented field. So we'll address that a bit towards the end of the presentation. Okay? So let's start by talking about the different types of degrees that you can earn in psychology. And there are really 5 main types of psychology degrees. You can, they're all listed here. You can earn an associate degree, a bachelor's degree, a master's degree in psychology, a PhD in psychology, or a doctor of psychology, PsyD. So let's talk about each one. And let's start with the associate degree. And with an associate degree, that usually takes 2 years, and I'm assuming that that's what most of you are pursuing right now, an associate degree in psychology. Now, to be completely frank with you, be kind of blunt, there aren't as many job options available for people that have an associate degree. So at this level, it's more difficult to find a job that is directly related to psychology. Most entry-level types of job in psychology professions require a bachelor's degree at the very minimum, and many of them actually require higher levels of degrees. So for most people, an associate degree really serves more like a stepping stone to further kind of like a stepping stone before you move on to pursue your bachelor's degree. So how many of you, that's what you're doing right now? This is kind of like the first step that you're taking in order to go and obtain your bachelor's degree. So yeah, that's the case for a lot of you. And I really feel that it is an important step, that getting an associate's in psychology really gives you a solid background in psychology before you move on to more advanced skills. So it is important what you're doing right now. Still, there are some options. They're limited, but there are some options. Certain jobs that you can do with an associate degree in psychology. Patricia, do you have a question, or that's an old hand?
You have a question.
Okay, no problem. Now, one possible job option, if you have an associate degree in psychology, is a psychiatric technician, and which with this type of job, you typically you will work like in a state mental hospital or in a residential mental health facility. And basically what you do is that you care for people that have mental conditions or maybe developmental disabilities. Well, more people are coming. And their annual median wage for psychiatric technicians is $37,380. The overall employment for technicians is expected or projected to grow about 9% in the next 10 years, which is actually very high. It's in fact much faster than average. Okay, so yeah, you have never heard of a psychiatric technician. I mean, it is a lower level position, and as you can see, the median wage is not extremely high. So a lot of people that pursue psychology, they might do this, like this might be a temporary thing to get more more experience and to be sure that this is something that they're interested in. But most people will continue pursuing higher levels of education. Now, with an AA degree in some states, including in Florida, you also have the option of maybe working in certain types of social work. Like, for example, you can work as a casework aide or an addiction counselor assistant, and that typically, in some states only requires an AA degree. So there are some options out there, but they're going to be really limited. Now let's move on to the next degree, which is the one that I feel most of you are probably, thinking of pursuing, which is the bachelor's degree in psychology. And that typically takes 4 years to complete. Now, in many universities, you will have the option to choose between two types of bachelors. You can either do a bachelor's of art, which is a BA, or you can do a bachelor's of science. That's a BS degree. Now, generally speaking, with BAs, they tend to require more liberal arts general education courses, and then the BS degrees tend to require more science general education courses. So depending on your interest and what you are hoping to do with that degree, then you will decide if a BA or a BS makes more sense for you. Now, once again, with a bachelor's degree, unfortunately, your options are going to be somewhat limited. There are really a lot more job opportunities in psychology for people that have more graduate level types of degrees. So again, for the majority of people that really want a career that is directly related to psychology, they're going to go on to graduate school. However, that bachelor's degree, is will provide you, can serve you with a solid basis for further graduate studies at in psychology later on. And there are also some entry-level positions with people with a bachelor's degree. That's why you want to go to grad school after you get a bachelor's. Yeah. How many of you are already thinking that that's what you want to do? You are planning or you intend to go into graduate school? Okay, so quite a few of you. Yeah, most people are interested in psychology. Yeah, they're thinking of going beyond a bachelor's degree. But that bachelor's is important because that's where you're going to be exposed to a lot of different subfields of psychology, and you're going to start having a more direct experience with the options that are out there. So yeah, I mean, that bachelor's is definitely important. And as I said, there are some jobs that the requirement is a bachelor's. You don't need to go beyond that degree. So one possible option is social and community service managers. They basically, in this job, what you do is that you coordinate and supervise programs and organizations that support public well-being. Oftentimes, people, social and community service managers work for nonprofit organizations or for social service companies, and sometimes they might work also for government agencies. The median annual wage is actually pretty good. It's 74,240. So yeah, this is a really good option if for whatever reason you cannot continue to graduate school, or if you just wish to stop at this level. And the employment in this area is also projected to grow at a faster than average rate at 9%. So that's really good. Now, with psychology, psychology is actually one of the most popular majors at universities. Many universities, psychology is one of the top 3 majors. But in all honesty, the majority of people that get a bachelor's in psychology do not end up working in a field that is directly related to psychology. There was one particular survey that found that only 27% of people with a bachelor's in psychology actually end up working in a field that is closely related to their degree. Now, I don't want to give you the impression that then getting a bachelor's in psychology is not worthwhile, or that it is not useful, because there are many other industries, many other areas and fields in which having a degree in psychology will be beneficial and could be really helpful. So like, for example, in sales, knowing about psychology, that can help you there. Administration, management, also having a background in psychology can be helpful. Teaching is another area in which knowing about psychology can help you in your career. So just because you're not going into a job or a career pathway that is directly related to psychology, that doesn't mean that this is not a worthwhile degree. There are actually a lot of famous people that study psychology as an undergraduate. Natalie Portman is one of them. She was a psychology major. Jon Stewart was a psychology major as well. How many of you remember the Miracle in the Hudson? That was that airplane that landed in the Hudson River and nobody died. This was some years back.
Yeah, I remember.
You remember that? Well, the pilot was a psychology major. So there are many different areas in which having that background in psychology can actually be really helpful. So keep that in mind, even if for whatever reason later on you decide that maybe being a psychologist is not necessarily the best option for you. You can still use the degree in a very beneficial way. Now let's move on and talk about the master level options, because once you get to the master level, more options are open to you. Now, a master degree typically takes between 2 to 3 years beyond the bachelor's degree. It is one of probably the most common degree that people that are interested in psychology pursue. And in part because it does give you more options than having a bachelor's, just a bachelor's. So with the master program, there are different types of master programs. Some of them are known as terminal degrees, which I know it kind of sounds like the degree is dying, but a terminal degree means that that it is an N-level type of degree. They're designed to prepare you to go directly into the workforce. However, many master degree programs are really meant to prepare you for doctoral level studies. So you get your master's, but you intend to continue onto your doctoral program later on. Now, Escalini is asking, how come someone with a bachelor's degree can earn more than someone with a master's? Yes, doesn't seem right? And that is the case, that it's not so much the degree, but the career pathway that you're selecting. Some, they just pay better than others. So that is something to keep in mind. One thing about the degree is that the higher level the degree, the more options you tend to have, but that doesn't always translate to more money. Now, typically, yes, because you have more options, then you have more options to look for a job that might pay better. But yeah, there are some job options with lower level degrees that actually pay really well. Well, sometimes you can have a doctorate and you might not be get paid that well. I mean, one thing when I first got my doctorate and I started, started working here at MDC with my starting salary, my husband used to tease me all the time because at his job, the secretary was actually making just a few $1,000s less than I was. And she only had a high school degree. And he kept saying, you went so many years, so much sacrifice, and you're just making pretty much the same thing as the secretary in my company. And but the difference is, and this is what I used to say all the time, is that the degree has a value, and that with a doctorate, with a higher level degree, whatever you're making, that's the starting point. It's just going to go up. With a high school degree, if you're making a really good salary, that's usually you're at the peak. It is not going to get better from that point typically. Also during hard times, it's the people with less education that typically get laid off first. So yeah, initially, especially when you're starting out, it might feel like financially it might not make as much sense, but as time goes on, then it tends to the options get better and your salary tends to get better as well. Now let's see some of the other questions here. Now clinical, we'll talk a little bit about clinical psychology and psychiatry. Now psychiatry really is a medical degree. You have to go to medical school to be a psychiatrist. So that's a little bit different. But clinical psychology is what I'm suspected that a lot of you, that's your intention. You want to be a clinical psychologist. That one, even at a starting level, the salary is not horrible. It's actually pretty decent. So we'll talk a little bit more about clinical psychology in a second. And Jadiel is asking, will a BS or a BA be better for those that want to go into a master? It depends. It depends on what you are interested in. So I wouldn't say that one is better than the other. And you also have to look at your strength. So if you really are into science and you like math as well, with a BS, it's not only more science courses, but oftentimes you are required to take more math courses as well. So if you enjoy that, then maybe a BS is a better option for you. If you hate math, and first of all, if you are going to psychology, you're going to need some math. You're going to, at the very least, you need to be really knowledgeable about statistics. But with a BA, you don't need to take calculus, for example. With a BS, you might have to, depending on the programming in your university. So you have to look at your own strengths and then look at what you want to do. If you want to do research, then sometimes a BS might actually be better. But if you're more interested in the clinical side of it, then maybe a BA will be a better option for you. If your goal is to work remote? Can a psychology degree help with getting a remote job? Yes, we'll talk. Let me, I guess I'll jump to that then, because that is an option. I think a lot of you are interested in, how many of you are interested in clinical psychology? Okay, so some
Could you
of
elaborate
the
exactly on what clinical psychology really means? I feel like I always hear that term, but I never really understand what it actually means. Clinical psychology.
okay. Okay, so let me not jump to clinical psychology yet, because I think that for some people, and thank you, Jardiel, because I think that a lot of people assume that being a clinical psychologist is kind of the same thing as being a therapist or a counselor, and there are some differences between them. So with a master's degree, you can be a therapist. You can be like a marriage and family therapist. Is an option. You can be, a school and career counselor or advisor. Now, to be a therapist, you need in I believe in every state you need to be licensed in the state that you want to practice. So definitely, if you want to practice in Florida, you have to get your master's degrees, and then you have to pass the test to get licensed. If not, you cannot practice therapy. But that's not exactly the same thing as being a clinical psychologist. Clinical psychologist is really a doctoral level type of career. So you need to get either a PhD or a Psych D to be a clinical psychologist. Now, Hannah mentioned here that she's interested in therapy, but she's also interested in research. And you can be a therapist and also do research, but those of you that are interested in kind of doing both, like doing psychotherapy, but you also want to do research, you probably are going to then go for a doctoral level degree. That degree is the one that is going to give you the most option to actually participate in both. Now, I want to, so to work remote, you will need a PhD. Not necessarily, Melanie. You can be a therapist, like a marriage therapist, and work remotely. Many therapists, that's what they're doing now. So you don't need. In fact, I would say once you get to a graduate level degree, so a master or higher, your options for remote work do expand. You have more of a probability of finding jobs that are completely remote. Jessica is asking here, when it comes to neuroscience, does being a psychology major help me advance in that career? Yes. This if you're if you're interested in neuroscience, there are different things that you can do. So you can, if you're interested more in research, and you're interested more in the biology of it, then you might be interested in going to a field that just concentrates in neuroscience. But you can also go into neuropsychology, which looks at the brain and how the brain is related to behavior, how the brain affects your behavior, basically. So having, you can, so if your ultimate goal is into going into the field of neuroscience, then as a bachelor, you can either do a psychology major or you can do a biology major. Either of those majors can be helpful into that area. In fact, that's my area of specialization. I specialize in neuropsychology, but for my bachelor's, it was actually biology. That's what I majored in. But then at the graduate level, the programs were all in psychology.
Yeah,
Now,
it's really interesting. I've always thought of neuroscience because I kind of just want to continue looking into the brain and looking into how it works instead of helping problems with people with issues, I guess.
Yeah, so I mean, it sounds like what you're interested is in research. So for that, what I will advise is to do a doctorate. A doctor of philosophy, so in psychology, so a PhD. That would be, the option if your main interest is doing research in neuropsychology or in neuroscience. Now, Hannah is asking, how do you become a neuropsychologist? So if you are interested in neuropsychology, there are really two options. You can either do the PhD or you can do a Psych D, Doctor of Psychology. And you can see I have some information about neuropsychologists here. So what is the difference between the PhD and the Psych D? And with a PhD, basically, you tend to take more research-oriented courses and a more research-oriented approach, but it will still include some theoretical and applied training as well. While a Psych D tends to emphasize more of like the practical side and actually treating people. So as a neuropsychologist, you can treat individuals, you can help, you can do like batteries of neuropsychological tests and interact with patients directly, or you can do research. And most neuropsychologists will do a combination of both, but depending on what your main interest is, you will decide whether you want to pursue a PhD or pursue a Psych D. So typically, you have to go basically all the way. Now with neuropsychology, let's kind of talk about some of the things that you can do, because how many of you are interested in neuropsychology? Okay, we have a couple of people interested in neuropsychology, and with what neuropsychologists do, besides that interest between the brain and behavior, they will study different aspects of psychology. So they might study like memory or perception, behavior, obviously, as well. They also study the effect of injury on the brain, or the impairment that can occur to the brain due to things like illness or aging as well. There are some neuropsychologists that assist patients directly in trying to help them figuring out long-term care. Like, you might specialize in Alzheimer's and work with Alzheimer's patients and help them deal with the declines, the cognitive declines that they are experiencing. And it is an area that is pretty popular, and the mean annual salary is, as you can see, really good, 106,420. So, it's a very well-paid area. The job outlook is 5%, which is lower than some of the other options that I have shown here, but it is still higher than average. The average for all occupations is 3%, so it's still a bit higher. Hannah, I've never heard of a doctor of psychology, that's Psych D. Can you go directly into this degree after a BA? Yes, you can do that. After a bachelor's, you can either go directly to a PhD or directly to a Psych D. Now, the Psych D, the reason maybe some of you have not heard of it is because it is a newer program. This one was developed, really not that long ago as an alternative to the more traditional PhD. And the PhD kind of gives you a very rounded education that emphasizes research. And there are a lot of people that go into psychology that they're not as interested in research. They want to treat patients directly or clients directly. So that was kind of the reason why this degree was developed, to emphasize patient care instead of research. However, many people have Psych D, they are interested in research as well. And they might conduct research, but it's just not their primary focus. Now, one thing that I would advise for all of you, this was an advice that I received when I was a student, and I think it was good advice, so I'm going to pass it along to all of you as well. And that is that even if you go into a program that goes directly into the PhD, consider getting a master. Those programs, sometimes you have the option. You're in the doctoral program, you already have been accepted, but you can still get, a master and then get the doctorate. While other people choose just to not do a master thesis and just start working in the doctoral dissertation, relatively quickly. But what I was told was to just get a master, even if you are already in the doctoral program, because you never know what might happen. I mean, doctoral programs can take up to 6 years, and in 6 years, a lot of things can occur, and you might not be able to finish the degree. But if you at least got the master, at least you have that to show for. But let's say that you were in a doctoral program, you decided not to do a master thesis, and you've been in that program for 5 years, and something happened and you had to drop out. Now you don't have a degree. Even though you were taking courses for 5 years, you don't have a PhD or any other higher level degrees. What you have is a bachelor's in psychology. So with the master, at least if something happens, you still have that degree. So yeah, I would advise you pursue that. That master thesis can serve kind of like the first step to your doctoral dissertation. You can just do a continuation of the thesis in your dissertation. So it's not like it's going to take you longer necessarily if you do that. So doctoral programs take at least 4 years on top of the 2 years of the master. Well, not necessarily. It is typically 4 years after the bachelor's. So it might take you 2 years. If you do the combination master and doctorate, you might take the first couple of years to do the master, and then another 2 years, 2 or 3 years to finish the PhD. And these are averages. A lot of people might take longer, and some people, which is actually kind of rare, but some people can actually do it a little bit faster. Some of it depends on just life circumstances, but sometimes it depends on luck as well. I actually took a little bit longer, and one of the reasons was that the population that I was working with was older adults, and I was looking at bilingual Alzheimer's patients. And I thought that I was going to have an easy time finding bilingual Alzheimer's patients. And if I went to Miami, to Hialeah, I will find them. And I actually had a hard time finding people that were truly bilingual. So, my project had been prolonged, and I ended up staying a little bit longer than what I initially anticipated. And I says I have to get first the master to access the doctoral degree, or can I choose a master or doctor? Yeah, you don't need to do the master. You can go directly into the doctoral program. Without doing the master. But as I say, you never know what might happen. So, apply to the doctorate program. And if you get accepted, going directly into that program, but then within that program, do what you need to do. If it's an option, and in most university, this is an option. You can do what you need to do to get a master when you were accepted in the doctorate program. Does FIU offer the option of going straight to a Psych D after the bachelor's? I believe that they do. Well, I'm not as familiar with the Psych D program. I'm not 100% sure that they offer a Psych D. I know that they offer a PhD. But most Psych D programs, they're done directly from a bachelor's. Most people that go into a Psych D, they're not thinking of getting a master first and then applying to Psych D. But I'm not sure exactly if FIU have a Psych D. I know that Carlos Abisu does have a Psych D. Now, I know several of you were talking about remote options. So I want to talk about that as well. So yeah, technology has really have a huge impact, not just in psychology, but in a lot of other areas. Do I know? Not from the top of my head. The PhD is a more popular degree. Well, I guess popular is not the right term. It's a more common degree, and because it's been around longer, so most big universities, well-known universities, will have a PhD program, while Psych Ds, they're newer, so not all universities will offer them. But definitely more and more of them do offer Psych Ds. So look at the universities that you are interested in and see what the options are. I know I went to Florida Atlantic University, and they don't offer a Psych D. Their PhD program is really heavily influenced, or it tends to really enhance or talk a lot about research, In fact, the PhD in FAU is really a PhD in experimental psychology, and then you specialize in different areas. So that's their emphasis, is really on research. So that kind of determines whether they offer a PsyD or not. Universities that really emphasize that they are considered research universities, typically what they offer is the PhD, but there are a number of them that offer both. Yes. So psychology of work. Well, let me make sure I don't miss anybody here. So Maria says, first is the associate psychology, and then a BA. Then you can choose a master if you wish, or you can go directly to a doctoral degree. Now, Liliana mentions about psychology of work. In fact, before I talk to you about the different types of on how psychology, technology has impacted psychology, let me mention industrial and organizational psychology. So that would be this, word psychology of work will be a part of. And this option is leads to one of the highest paying career pathways in psychology. You can see the median pay here is 139,280. So really good. How many of you have heard of industrial organizational psychology before? Okay, so some of you have, but for some of you, I imagine that this might be new, that maybe you have not heard of it before. And with industrial organizational psychology, basically this type of psychology is focused on improving the quality of work life. And you're taking a class in psychology of work right now. Yeah, it's actually really interesting, and it is very practical in many ways. These type of psychologists are interested in increasing the productivity of workers and maintaining kind of like a healthy work atmosphere. So they study, what are the factors that contribute to that, and they apply those psychological principles to things like human resources and administration, management, sales, marketing problems, that kind of things. So basically, when you go into industrial and organizational psychology, you're working for companies. So that's part of the reason why the salaries tend to be higher than average. So, how many of you are now thinking, this might be an area that I might go into. This might be an option. Yeah, and I'll give you, some more good news here. I listed it under the doctoral, PhD options, but you actually do not need a PhD. There are many companies that what they require is a master's degree, to work as an industrial and organizational psychologist. Now, if you have a PhD, that opens more options, and that gives you more flexibility. But once again, a lot of places do not require the PhD. You just need a master. So that's a lot faster and less expensive to acquire. Lilian also mentioned positive psychology. Now, positive psychology is a wider, kind of paradigm within the field of psychology. So there are a number of different things that you can pursue if you have an interest in positive psychology, and definitely industrial and organizational psychology uses a lot of the principles of positive psychology. So if that's an interest of yours, this might be one career pathway that you might want to go into. But also therapy, clinical psychology or other forms of like family therapy or marriage therapy also can use a lot of the principle of positive psychology. Now, let me go into how technology is having an impact. And this is where, some of that remote working might be playing a role. So first of all, technology has been part of psychology for decades. Even before this century, psychologists have been using technology. Some of it has been to, analyze data. Computers makes it a lot easier. But, psychologists have been using technologies in other ways as well in the field, like psychologists have been using like MRI scanners and EEG machines for decades already. But in more, recent times, more recent years, we have seen a lot of increases in developments in digital technology, and that is really advancing psychological treatment, especially after the COVID pandemic. We are seeing that psychologists are using technology a lot more to treat psychological conditions. So Maria here mentions that she would like to work with the Army, maybe give therapy to them or something like that. And chances are that if you're doing that, you're probably going to be engaging in teletherapy, which has become really, really popular. And teletherapy, you probably can figure out what it is. It consists of mental health services and counseling that are being provided through the internet rather than in person. Some people do kind of like a hybrid method or approach in which you do a combination of video calls, using Zoom, or maybe you can use Skype or FaceTime, but they might combine these with other forms of communication, like maybe through text messaging or phone calls, or even in-person sessions. Now, as you can imagine, this is really convenient for the clients. It takes less time to do it. You can do it from home. It gives you options of different therapists, because if you're really interested in one therapist but they live far from you, you can do teletherapy. So it is convenient for the clients, but it's also convenient for the therapist. You mentioned, will it be viable to travel the world while doing teletherapy? Yes, as long as the places that you're traveling have reliable internet. So that's one of the issues, that you have to make sure that you're going to have access to internet. But if that is possible, then yes, you can be traveling and be conducting teletherapy. In fact, I know somebody that she's a therapist and she lives in Minnesota. And about a little bit over a year ago, she was actually working doing therapy face-to-face, and then she changed jobs, and now she's doing it completely remotely. And her clients are actually, they live in Arizona. They're all from Arizona. She's working with the migrant population over there. And it's not just with migrant workers, but with families of migrant workers that she is providing therapy. And the other thing in her case is that, she hates the Minnesota winters. So since she got this job, she's been traveling back and forth to Puerto Rico during the winter. She stays there for about a week or two, and then she goes back home, and she hasn't taken any vacations or anything. She continues working while she's traveling to Puerto Rico. Now, will you need a doctor or a master? It depends. So if you are doing, for most therapists, what you need is a master, and then you have to get a license, which can be tricky when you're doing teletherapy, because if you're in one state but you're practicing or doing therapy in another state, then you have to be licensed in that other state. So so one of the issues, and what some states are doing, is that they're providing licenses that cover several states. So you have to be careful about that. So the person I was telling you about, when she got hired, at first they did not realize that she didn't actually have the license for Arizona. So they had to kind of figure out exactly how to get her a license. And now that we're getting more and more experience with this, people are getting better at kind of covering that. But if what you are interested in is in clinical psychology, that's a higher level. In fact, if you have a master, in most states, they cannot call you a psychologist. You will not be technically a psychologist. You will be a therapist. Now, to be called a psychologist, you need to have a doctoral level degree. You have to either have a PhD or a Psych D. And then, so depending on your interests and how much more studying you want to do, then you might want to pursue that doctorate. Now, there are other options. you need a license for both states. You need a license for the states in which you are going to be practicing. So if your clients are, basically you need the license for the state where your clients are. So yeah, if you're like my friend that travels to Puerto Rico all the time, she doesn't need a license for, a Puerto Rican license. She only needs it for Arizona because her clients are in Arizona. So it doesn't matter where the therapist is. It really is, you have to make sure that you're following the rules in the state that the client is. Now, obviously, if the person is on vacation and they travel to a different place, then you don't need the license of the place that they're traveling. It's only the license of the place where the person resides, basically. Is it possible? Right now, I don't believe that there is one like general license that will cover all 50 states, typically, because each states have slightly different criteria, so it's difficult to do just like one general one. But that is something that some people have discussed. So I can imagine that maybe sometime in the future that might be a possibility. But to get to that point, there has to be agreement between the boards, the licensing boards of every single state, and that sometimes can be difficult to reach. But yeah, right now that is not the case. And think about it, most of you will not be practicing in all 50 states, or not even in 10 states. That's going to be too much, because once again, each place might have slightly different rules. Now, therapy is probably the most well-known and the most widely method of using technology to treat psychological conditions, but there are other options as well, like apps, for example. They can also be helpful for managing mental health, and the apps can range in terms of the purpose and that the support that they can provide. But there are some apps that can be used like to do mindful exercises or to help with cognitive and behavioral therapy. But you can also use the apps for things as simple as trying to find more information about the services that are available, or to make appointments. That's one way that is being used in this field. Virtual reality is another one, VR, that can be used to treat a number of different mental health disorders, like anxiety and post-traumatic stress disorder. The NHS, for example, have used VR successfully to treat social anxiety disorder. And there are a lot of studies that are trying to see how this can be used for other types of disorders as well. Do I think it is worth it to keep studying that much until the PsyD or the PhD? It is a lot. I will say that it depends on what you want to do with that degree. So if your main interest is research, then I will say it is worth it. You will have the most opportunities to do research if you have a doctorate. It is possible to do research with a master, but your opportunities are going to be more limited, and then you probably will not be like the lead investigator, which means that you're probably not going to be making as much money. So if you want to be the one in charge of conducting the research, yeah, you will have to go all the way to the doctoral level. But if your interest is more on providing therapy and treatment, then a doctorate might not be necessary. A master degree might be all that you need. I also really advise, and this is, I guess, a good advice for any graduate level degree, is that you have to like what you're doing. If you see this more as a hassle, something that you have to do to get where you're going, but you're not enjoying it, then it might not be worth it, because a doctorate degree, pursuing that doctorate degree, is a lot of work. While you're in graduate school, you don't have a life. You're just studying. You're just doing a lot of work. It is stressful. I personally think it is worthwhile. I did enjoy graduate school, but yeah, I did not have a life while I was in graduate school, and I was under stress, but I was enjoying what I was studying. I loved reading all those articles and learning more about it and coming up with experiments and things like that. But not everybody loves it. Some people do it more because they they like the idea of being called a doctor, but they don't necessarily like what they're doing. And if that is the case, then this might not be the best option for you. And I also think it takes time, and everything that takes time costs money. So, if what you want to do doesn't really require a doctorate, then and you don't love, school, and studying all the time, you view it more as a hassle, then you might not want to go all the way to a doctorate level. But having said that, I did enjoy it. I thought it was great, but you have to like it. If not, I don't
Yeah,
think it
I
would be
mean,
worth it.
I feel like I love
Yeah.
my major. However, I also think it's long time, and I also want to be able to make money and, but
Yeah,
I do like a lot my major, and I enjoy learning about the brain and, but I also think it's a long, long time.
yeah. Yeah, and if you look at the financial side of it as well, there is also the issue that the difference on average between what somebody with a master earns and somebody with a doctorate typically it's not a huge difference, not especially when you take into consideration all the extra effort that it requires to get a doctorate. So again, I mean, you have to decide, what is it that you like, what is it that you want to do, and is it really worth it? Do you need to take those steps, and why is it that you are considering going all the way to the doctorate? I know a lot of people that they want a doctorate mostly because they feel that this is what they're supposed to do, and it's not necessarily because it is something that they love, or they do it because they want to be called doctor. And that the chances, I mean, when I got my doctorate, a lot of the people that were calling me doctor, they were doing it mostly to tease me. Like my siblings, they were like, oh, doctor, whatever. Well, it's in psychology, that's not a real doctor, and stuff like that. So if that is your only motivator, then that's not a good motivator. Now, we're actually getting close to the end, and I do want to talk about women and how it is affected. So I'm going to skip this and jump to the opportunities for women in psychology, because psychology has become a female-oriented field. That wasn't the case like 50 years ago. In fact, back in the 1970s, women receive about 45% of all the bachelor's degrees in psychology. And when you look at the PhDs, it was even less. It was only 30% of all the PhDs in psychology. But nowadays, there have been a huge jump. Nowadays, about 80% of all bachelors in psychology are awarded to women. And that's actually a 35% bump from the 1970s, which is huge. And the increase has been even greater for PhD, about just under 75% of all doctoral degrees in psychology are now awarded to women. That's actually a 45% bump from the 1970s. So you can see, that there has been, a lot more female representation in the area of psychology, which it is a good thing. More women are in psychology. Now, why is that? And there are probably two main reasons. First of all, generally speaking, more women are going to college. More women are pursuing degrees. Right now, if you look at the average around all universities, there are more women pursuing bachelor's degrees, and there are more and more that are also pursuing graduate levels degrees. So just because of the numbers, we're going to see more women in the field of psychology. But the other thing is that a lot of women say that they're drawn to the field, especially the clinical areas of psychology, like therapy and counseling, because they view themselves as being empathetic. And in fact, a lot of women feel that they're more empathetic than the average male. And many men that do agree with that as well. So that's part of the reason why we're seeing more women. And that's the good news. However, not all news is good. One of the things that we see is that even though the majority of the sub areas in psychology have seen an increase in women. That is not the case for all of them. Means quite a few of you indicated that you're interested in neuropsychology. And we're seeing more and more women enter the neuropsychology field, but it is still dominated by men. There are still more men in this area than women. Now, let's hope, maybe in a few years that will not be the case anymore. There will be more women, but, there's still that gender difference. Still, it is way better than 10, 15 years ago. The other thing that I will say is of more concern is that when you look at the increases in PhDs, they have not really led to an increase of women professors in the area of psychology. Like when you see associate professors and full professors, they typically they're more likely to be male. In terms of associate professors, so those associate professors will be more like a lower level of professors. And the gender breakdown is about 50-50, half men, half women. So you might be thinking, okay, that's good. It's half and half. But when you take into consideration that most of the PhDs are being awarded to women, then you would expect that there should be more female professors. And then when you look at full professors, so those are the higher ranking professors, the ones that have more benefits and more seniority, that the discrepancy is really large there. 70% of those professors are going to be male. And we see this in other leadership areas as well. It tends to be dominated by males. Now, the good news for women is that when you ask women what is it that they're looking in a career path, many of them say that they want flexibility. And in the area of psychology, there are many career pathways that offer that. I mean, we have talked about some of them, like you can do teletherapy. And in higher education, oftentimes you can kind of choose your hours, when you're going to do your research and when you're going to teach and that kind of stuff. So there are many options that are more flexible. So that is helpful for women. On the other hand, people have complained that because there are so many women in the field now, there's less diversity, and that there is a need for male therapists, for example, or male in the mental health fields, because there might be clients that will feel more comfortable with males. So that has been one concern. There's also have been concern that because women typically earn less than men, that is going to drive down the average salary of psychologists, but the evidence does not support that. Now, yes, there is a gender gap, and women in psychology, women that have a PhD that have recently graduated and they're starting a career in psychology, they on average earn $20,000 less than a man with a PhD that is starting out. So there is definitely a gender gap still in psychology. But the fact that there are more women doesn't seem to be driving the salaries overall for everybody. Now, we're already at the end of the hour. So, we have run out of time, but if anybody have questions, I can stay over for a little bit longer. So, are there any questions? And I see somebody raise their hand, but I cannot see who it is.
Here.
Whoever it is,
So
you can...
I wanted to,
okay.
it's Maria.
Okay,
I wanted
yes,
to
Maria.
ask you, I would like to do something with social media too, like sharing a lot of content on social media. But there are any restrictions for it, or
Yes.
any?
Yes, there are. That is actually an option, and I know. It is one university up north actually has. Can't remember the university right now. I want to say it's the University of Minnesota, but I might be wrong. It might actually be Michigan. They have a program that is really in the social media department, but it's with it combines psychology and social media and media in general. So they look at how they look at psychological principles, and they look how media is being impacted by those, or how psychology impacts media. And you can concentrate on social media, but you can concentrate in all other aspects of media as well. And there are more and more programs that are doing that. A lot of these programs might combine aspects of marketing together with psychology, or media studies. Some of these programs are really in the departments of media studies, but then they have a psychology component to them. So you have to take a lot of psychology courses and be knowledgeable on that, but then also be knowledgeable about media in general as well. I know my daughter, actually, she's interested in media studies. That was her interest, and in writing. And when she was looking at different programs, she ran into a few of those that was looking at psychology, and they look really interesting. And because this is a newer area, and it's really an interdisciplinary area, there aren't as many people into that field, so there's a lot of options for those that are actually knowledgeable in both media and psychology.
Thank you.
You're welcome. Any other questions?
If you want, my name is Liliana. And my question is, if I want to write to help people with issues, psychological issues, where is the way to get this point, these goals? I don't understand if you I expressed very well.
No, I think I get what you're trying to say. So if your main interest, and I suspect that for a lot of you, your main interest that you want to help people. So you're thinking of doing counseling or therapy. There are actually many options of what you can do, what you can pursue. So first of all, you can specialize in a particular area that you might want to help. So like maybe become an expert in a particular, specialize in a particular type of disorder, and then help people that have that particular disorder. Or you can learn, specialize in a particular age group. But you can do, to help people and provide, counseling. Basically, you can be a counselor, which tends to be a master's degree, typically. But you can be a therapist as well, and that will be a master's degree program as well. But then, if you would like to combine this with research, or want to kind of study, whatever whatever you want to specialize in at a deeper level, then you might want to pursue a doctoral level. And if your main interest is helping people directly, then you might want to go for a PsyD instead of a PhD. So there are different options, and that's one of the things about psychology, is that if you want to do therapy, it's not like there's only one thing that you can do to end up in that. There are many different options that you can pursue that can lead you to therapy. So it's not like there are different cubes that or pathways that are very strict, and that's the only thing that you do. And if you deviate from that, then that's it. You will not be able to work in that area. No, that you have a lot of options, and a lot of those options are kind of flexible, which is another advice that I would like to give to all of you. Stay flexible, because you never know what opportunities might open up for you. And when you see an opportunity, take it, even if you're not sure if that's what you want to do. So when you go to graduate school, or even as a bachelor, in fact, as a bachelor, you should do this. Look for professors that have labs in psychology that are looking for assistants, that are looking for students to help them out, and volunteer to work there. Because first of all, you get experience, you learn more about whether or not you like that area, and also it gives you a leg up when you are applying for graduate school, because you already have some experience. And from that experience, by being part of a lab, you start building your network. So later on, when you're looking for a job, there are people that might be able to help you with that. Now, I know that a lot of you need to leave, so if you have to go, that is fine. But if you have more questions, feel free to stay. Yeah. Let's see who is. I need to look at I don't have the participants here with me. Okay, Maria, you have a question?
Oh, no. I'm good. I think I forgot to put it down.
How about Jardien?
Yes, I wanted to ask what if you know what the median typically wage would be for like teletherapy.
For which one?
For
Teletherapy?
teletherapy,
Oh,
yeah.
okay. So with teletherapy, that's going to be a really wide range because you're including people at different levels. So there could be some counselors that are conducting teletherapy, and those counselors typically earn less. If you are a clinical psychologist, then you tend to earn more. So there's going to be a wide range. But generally speaking, when you look at psychologists as a whole, and you kind of averages what people that are in more directly associated, related fields of psychology are doing, the average annual wage is about $81,000. But keep in mind, the range is going to be very, very wide. Did that answer your question?
Yes, thank you.
Okay.
Oh, I wanted to
And
quickly.
also, one thing to keep in mind also is that it varies a lot by state. So yeah, we're in Florida, so we don't have the best wages compared to some other states. So if you go like towards the Northeast, for example, you tend to earn more than some of the southern states. Kevin, do you have a question?
Hey, Professor, I wanted to quickly ask real quick. I thought that you were recording this. Would this be available somewhere for us to view it?
Yes, I will post it to those of you that have classes with me. I will post that. I guess I will put my email here for everybody. So if you are not in one of my classes and you wanna, the recording, just let me know,
Okay, perfect.
and I can forward it to you. So let me put my yes, there.
My question was, you
Yes.
talked about specializing. That would just be you get the master's and then you specialize further into the field in the actual practice. You don't have to specialize by getting a PhD into that field, right?
Oh, in most PhD programs and master programs as well, they will ask you to what your specialization is going to be. So you get the degree in psychology, but then you specialize on something. So the education will still be well-rounded. You're going to take, courses in many different areas of psychology, but then in the area that you're more interested, you're going to take most of these courses in that area. So, my specialization was neuropsychology, for example. I had to take, social psychology, cognitive psychology, and all of that. But a lot of my my courses kind of emphasize more the neuroscience aspect of psychology.
Okay, thank you.
Oh, and yeah, for those of you that are leaving, you're welcome. It's been great, and all of your questions have been excellent. So, I really appreciate your participation here as well. Any other questions?
Professor, I have a question.
Sure.
Okay, so I had read somewhere, I didn't do further research, but I had read somewhere that if you get a bachelor's in psychology, then you can you can keep going to school after you graduate and become an HR specialist. Is that something that's possible, or is this something I just read that's not true?
No, that is possible. So I don't know all the the credentialing needed for to be an HR specialist. So I don't know exactly what kind of schooling you have to go beyond the bachelor's. But yeah, that is one area that having a psychology background is really helpful. And a lot of time, HR specialists, they actually are recruiting people that are knowledgeable in psychology. So yeah,
okay.
and typically it's not to the doctoral level, and sometimes it might be more like in some places it might be more like a certification kind of thing. Some extra courses that you need to take, and you don't need to go all the way to have to do like a master thesis or anything like that.
Okay, thank you so much, Professor. Have a wonderful day.
Oh, yeah, you're welcome. Thank you.
Thank
And
you.
then Carrie?
Yes, Professor, I have a question. So, let's say I want to do my master's degree, right? But then in the meantime, once I get my bachelor's, what do you have any like suggestions of like careers that we can do, or like jobs that we can have in the meantime while we get our master's?
Yeah, with so if you are interested in well, there are two advice that I will give you. For one of them is like what I was saying before, find out who are the psychology professors in your university. I mean, if you're a psychology major, you're going to already know a lot of them, and see if they have openings in their labs. So sometimes, most of the time, these are going to be, you can do it like for course credit, like it could be like an independent type of study, or it could be part of a class, so you're getting credit that way. Sometimes they do have paying positions within those labs, like you can be a research assistant. Typically, it's not like you're going to earn a lot of money, like to be able to support yourself, but it could be some extra spending money. And a lot of times it will be more of a volunteer type of thing. But by being in those positions, then you are already forming a social network, and then they might be able to know when there is a position in a related field, in a related area that is actually paying for it. So, that's one way to kind of find those type of jobs. So, a lot of times professors already know, which organizations are needing somebody that has a background in psychology. A lot of times those organizations will go to the professors and ask them, do you have any good students that might be interested in this? But the other thing that you can do is look at, especially because a lot of you are probably interested in therapy or on counseling, and then approach clinics, approach organizations that actually are conducting therapy, and ask if they either have shadowing programs in which you can kind of participate and either do volunteer, or if they have actual positions that they're hiring for people that have a bachelor's. You have sometimes to be a little bit creative to try to figure out the jobs, because a lot of times nowadays it's more about who you know. So that's why it's good to get to know your professors, and then take every opportunity when they offer options or opportunities to participate in either research or in some kind of work that is somehow related to psychology. Take them up on that, because that's how you're going to learn of other possible opportunities in the future. And the other thing is that once you prove that you're a good worker, people will actually come to you. That's what I found when I was as a graduate student. I would say yes to every opportunity that will come, and after a while, people were looking for me. Different places that they needed somebody that had a research background that they knew that they could rely on. They will come for me, and then a lot of those positions were paying positions. Any other questions?
Thank you, Professor.
Oh, no, you're welcome. I think we're done. But if anybody here has questions later on that you think about, feel free to email me, contact me, and I'll be happy to answer any question that you might have. And if I don't know the answer, I will try to find out for you. Okay? So have a wonderful rest of the day.